Hi, my name's Rowan. I'm an urban curandera, and I'm talking about Vag TV today and what you can do to help support yourself having a more successful induction if that's where you find yourself. So, a lot of folks feel a lot of pressure to be induced, and to go in the hospital. And if they're having some type of medical reason that they need an induction at a hospital, that's fine. But sometimes there's just a sense of urgency within the medical community, and maybe a person's body's not quite ready yet, or whatever. What can we do to help folks who are being induced? And it was explained to me that an induction is only successful once labor starts, right? So it's an attempt at labor induction if you're in a hospital and they're putting maybe Cervidil up in your cervix, or being given administered Pitocin, that type of thing. That those are attempts at induction, and an induction is only successful once labor is actually started, right? So what can we do to help you, dear reader, have a successful induction for labor in a hospital setting? So that's the topic for today. So in a past video, I talked about Vag TV, and that's when you become simply a vagina or a cervix. Like, nobody's really even seeing you as a whole person anymore. That it's just like, oh. And they look at the monitor, then they look back at you. They look back at the monitor, they look back at you. But they're not really seeing you as the person that's in labor. You've just become a cervix, or just the whole thing is pretty detached, right? So how do we kind of mitigate all this, right? So I want you to think about interventions, right? And really the first intervention is not being in your own home. That's the first intervention. So there's not much we can do about that. You're at the hospital if that's where you're having your baby, and you have a medical provider, probably a doctor, who's wanting to induce you. Okay. It could be a midwife, but most commonly people in hospitals are being served by a doctor, which is fine. So you're there. So I want you to think about whether you need to wear clothes other than your own, because that's an intervention, right? When you're wearing that kind of weird ass hospital gown that seems to fit nobody, what if you were wearing your own clothes, like either your own jammies or your own shorts and a t-shirt, or what if you were wearing your own clothing? That might make you feel more comfortable, right? So that's a way to already just kind of take a little bit of your power back, because essentially, in order for an induction to be successful, a lot of things need to line up, but mostly we need your body chemistry to start getting on the labor train to kind of get things going. So I want to remind you that Patrick Hauser, who's a guy who talks a lot about men becoming fathers. I was in a conference where he was speaking, and he said that Dr. Michelle O'Donnell, who's a huge water birth fan, he was advocating that men not be in the birthing room at all, which was making Patrick Hauser like kind of flip his shit. But he said that it's not men in the birthing room that are slowing things down, it's adrenaline and anxiety. So whatever we can do to figure out how to keep your adrenaline and anxiety mitigated in a hospital will allow those interventions to be that much more successful. Right? So we're talking about the kind of interventions to induce labor here, as you interventions to induce labor. So whatever we can do to help you with that, right? So the first thing I'm advocating is really choose your interventions wisely. So I would totally say, if you can get away with wearing your own clothes, do it, right? So the second thing is, like, craft the environment around you, because it's already anxious enough that you're there. You're maybe a little bit intimidated. There's a lot going on. So let's kind of create an external environment that can help you feel more safe and secure, so that the chemical in your body, right, which either could be your own oxytocin, or maybe it's something supplanted by the medical community, but all those can work more effective, because nothing really sucks more than being there in the hospital waiting for these interventions to kick in, and you're just kind of frozen and like that. So wearing your own clothes, playlists are really good. Maybe some aromatherapy that's not a candle. And aromatherapy really isn't that hard. You can just dab the lavender bottle like right on your own ear or on the pillow or whatever. And if there's a Snuggie blanket that you enjoy, then bring that. and jam your partner there in the bed with you. There's no reason you guys can't be snuggling in that bed together. So these are things, I know it's tight, all right? I know you're big, all right? But these are things that you can do to create that environment around you that allows the chemicals and the interventions to already work that much more effective. And every time, if there's a message that you get about maybe you're not good enough or anything like that, I want you to consciously replace those anxiety. Because remember, anxiety is the antagonist to oxytocin and to these interventions. So every time you have an anxiety thought, let's switch that. Let's switch that for a thought that makes you feel secure and happier and brings a smile to your face. I had a client come in, I guess 2 Saturdays ago, who was like totally getting the shame message from one of her providers, and had actually had been checked, and there was not a lot of change, and the provider had said, "Oh, there's no change." Like, while she still had her hands up inside of my client, which is devastating. Just devastating. So the message she took away from that was, my body can't do this, or you don't believe in me. And I would get her kind of talked off the ledge and feeling good, and then she would, like, that would start to come back in her head, and then I was like, okay, we can't, you don't have the luxury of this negative thought, right? So I was telling, that was my Saturday client, so I was telling her the story about a client I'd seen the Friday before, that I was like, okay, let's watch your favorite movie, because when you watch a favorite movie, it brings laughter to you, the parts are still funny, things are still going on. It kind of creates that lift and mood for you. And Ina May says that if your mouth is open, then your bottom is open. And that's what we want. So, ha 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 ha. So, my client was saying that she had one movie that she totally loved. Ever since she was a kid, she loved that movie. And I was like, oh, that's great. That's great. I couldn't imagine what it was. And she goes, yeah, I just love this movie. I've watched it longer than I even understood what the drug innuendos were. I just love this movie. And I was like, well, what is it? And she said, 9 to 5. 9 to 5. Who thinks that 9 to 5 is the funniest movie you've ever seen? Like, not me. But I used that the next day to tell my client who was upset, every time you have an anxiety producing thought, you just think 9 to 5. 9 to 5. 9 to 5. What a way to make a living. And then all of a sudden your anxiety starts to go down. Because really, 9 to 5. 9 to 5. That's your favorite movie, 9 to 5. So whatever it takes for you to craft an environment while you're in hospital having an induction or an attempt at a successful induction, whatever we can do to mitigate anxiety, that's what you do. If it's 9 to 5, aromatherapy, pictures of your other kids, if you're listening to a playlist, you have a real chill friend maybe stay with you, anything you can think of to keep your anxiety down. Because what happens sometimes is they tell you some kind of like bullshit news, and then they take your blood pressure, and then it's like, oh shit, well, we got to do something different because your blood pressure's high. Well, of course it's high. You're fucking with me, right? Whatever we can do to keep your body smooth, serene, the environment around you, and you're working double time because you're in the hospital and there's a lot going on, but anything you can do to keep yourself happy and serene, that will carry and allow the induction attempt to go so much smoother. So much smoother. And even if it doesn't create a successful induction, how you will respond to upcoming birth choices will be much greater, and ultimately your healing will be much stronger. Let's see. Oh, I can see that I have 2 viewers. That's so exciting. Does anybody have a question for me before I wrap up this video? And it's totally okay if you don't. I'm just pumped I have 2 viewers. There's going to be time I'm like, oh, I only had 2 viewers. Okay, doesn't look like I have any questions. I guess the last thing I want to say is my name's Rowan Two Sisters. I'm an urban curandera. You can find me at urbancurandera.com. I have a mailing list, and I'm shooting out interesting things all the time. And if there's anything I can ever do to help you with fertility or scar healing or planning a birth or recovering from a surgical birth or a vaginal birth or pretty much anything, really, I'm always here, and I'll do whatever I can to help you feel more comfortable in your own body. Thank you very much.